Hello, good afternoon. My name is Sana. I have few episodes in terms of putting some of my discussion on YouTube um, for people to have some insight to a focus area in terms of mental health. I'm sorry I've not been to continue with this issue of presenting some of these topics. The rationale behind that, I've been very busy. We're engaging in a research at the moment, looking at 5 daily prayers and the impact of that on our physical and mental health. So, just an introduction. Whoever has done research on this, or is doing research on it, or has some insight on it, and you want to give us some more information on that, we are looking at the impact of 5 daily prayers on physical and mental health. And why is it that it's been prescribed for us? God has prescribed this particular religious practice for only Muslim. Other religious practices don't have 5 daily prayers, and other prophet that has passed, it has never been a compulsory prescription for them. So we have been prescribed 5 daily prayers. Has been prescribed like a medication to do on daily basis. There must be a reason why God asks us to do that. So we're doing that research and we're looking into the impact of that on physical health and mental health in terms of how benefit we have in terms of our physical health and our mental health. We are into this for quite a long bit of time now. We're doing the research in Birmingham, in Manchester, and some other small towns. We have so many good numbers of people participating in it. But the idea of sharing this information is that whoever happened to do research on this or has ideas or information that can be helpful, you can email me and then I can get in touch with you. sana.cisse2@nhs.net. All right, enough of that. The idea of today's talking is a discussion. As I already said, the idea of all this discussion actually brings some knowledge to the general public about mental health disorders. Initially, we have spoken about neurosis. When we talk about neurosis, we're talking about depression and anxiety. They are termed neurosis because they affect our emotion. So we have spoke about anxiety, we spoke about depression, we spoke about other things. My promise was to talk about chronic mental health diseases or disorders such as schizophrenic disorders, bipolar disorder, schizoaffective disorder, etc., etc. But they are big topic and they need to be addressed in such a way when I presented it, it doesn't have massive impact on people who listen to it. As a result of that, and due to how much sort of work I'm doing, I couldn't put it down into a language that I think will be understood, but at the same time have minimal impact on people in terms of negative aspect of it. But today's topic is going to be discussed on a particular area that is not classified as a mental health disease or disorder, but it's significant for both mental health and physical health. And this particular topic today will be called sleep. Now, sleep as a natural phenomenon, a natural process, is one of these 5 elements of survival that we needed to survive. And I think there has been quite a very limited knowledge or understanding or information about sleep. And you can verify that if you go into NICE guidelines, you go into NHS policies, protocols, and guidelines, you realize that sleep as a phenomenon is there, but the details of what is sleep, what sleep does for us, how we have to look at sleep as an essential part of our survival, I think that's a very little meat on the bone. The informations are not great. The insight of it are not great. So today my idea is to give you a little bit of meat on the bone, to have you some basic knowledge and insight, both the superficial one and neurophysiological one, so you understand exactly where sleep comes from and why do we have to sleep, why do we need sleep. If you don't sleep, what happened? If you sleep too much, what happened? Etc., etc. But before we go into that, I have already mentioned sleep is part of those 5 elements that we need for survival. We need to eat to survive. If you don't eat for a long period of time, you die. You need to drink to survive. If you don't drink for a long period of time, you die. You need to open your bowel. You need to go to the toilet for number 2. If you don't do it for a long period of time, you die. You need to pass urine. If you don't do it, you die. You need to sleep. If you don't sleep for a good number of time, you die. And this is important because if we understand that, it looks like that's a massive insight to eating and drinking, bowel motion, and urine fluid management. In any clinical setting you go, there is a massive policy around this and massive sort of intervention protocols in place. If somebody don't eat for 3 days, in NHS, you got food refusal policy. That massive policy, you read it, it gives you guidelines what to do. The same thing with bowel motion, the same thing with fluid restrictions. But what is limited is sleep. That is policy on sleep, but it's not details. It's not giving us more bone, more meat on the bone. So having understand that if you don't sleep for a good number of time, you die, it is important for us as public people to have some insight of what is this thing we call sleep. Sleep is one of those God's miracle. I'll call it miracle because, Ian Hensel, one of the greatest scientists, stated that it is going to a point where when you learn about science, you go to a point where you know nothing, and that's when you realize that you need knowledge. And I think most people who has gone certain level of their knowledge, you think you've gone to a far level of knowledge, you realize that you know nothing. And that's how I feel. I feel I know nothing. And then I think it gives me that curiosity to know more, to search for more, to look for more, to understand more. And at this stage of my career, that's the appetite I'm having. I feel I don't know anything, but what I do know, I want to share that with people so I can get more information with people, so I can get my curiosity fed, and hopefully that will give me more knowledge. And I think that's what is called philosophy. If you do have your PhD, whoever had PhD will understand that. It is a level where when you achieve, you realize that you know very little. And that's the point where you need to step back to start to find more knowledge, to know more. And this is where we are. And if we start looking at sleep today, most people who probably think have known a lot about sleep probably will have very little idea about sleep. So, but before we go into too much onto that, we just have to hit the ball rolling because obviously it's going to be a short video. Now, sleep, as I say, is a natural process that is essential for our survival. Most definition of sleep, whether you take it in a textbook or dictionary book, is it's a state of being unresponsive to external stimuli. Now, if you have to simplify that, it is a process where your working stimuli are at rest. Now, to put that into a simple concept, human beings have a process called homeostasis. Now, homeostasis is a process where we have what we call extraception and interoception, where our body maintains itself, its functionality internally and externally by maintaining the external environment and internal environment to make the body function. Now, to maintain the external environment to make the body function is called extraception. To maintain the internal environment to make the body function is called interoception. Now, a sleep is a process where your extraception senses are at rest. Some people call it your 5 senses are at rest. It's different from coma, it's different from death. Now, when you are extraception at rest, means that when you're sleeping, you don't see. When you're sleeping, you don't hear people. When you're sleeping, people touch you, you don't feel it. That sort of extraception perceptions are limited. Some people are very sensitive. It doesn't literally fall into everybody's category. Some people can be sleeping. The moment you make a slight noise, you wake them up. But that can happen only when somebody has gone through certain traumatic events and their body is super alerted or super vigilant. But we're not going to touch that. So extraception, a process where your working stimuli are of rest. So in that case, you are not in coma. If you are in coma, both your internal perception and external perception are not responding in such a way that your external perception is at rest, your internal perception is not responding. When we talk about interoception, we're talking about how your heart function, your stomach, your digestive system, your enzymes, your hormones, your neurochemicals, your neurobiology, all of these things are interoception, how your body internal process happens to make you function as a human being. So when it's there, none of these two factors work. You just don't have any interoception or extraception. You don't. When you are in coma, your interoception and your extraception are both affected. When you are at sleep, it's only your extraception that is affected. Your interoception is not affected. In fact, your interoception is doing repair work. So that is sleep. Now, the question is, how do we get into sleep? Now, we're going to talk about the biology of sleep, because without going into the biology of sleep, a little bit understanding how our body actually is manufactured, how God created us. I'll use the term God. Most people who watch this may not be religious, may be spiritual, but when I mention God, I mean from creation, we believe that we are all created by God, by a super being. On our makeup, we are created in such a way we have to go to sleep and we have to be awake. And that's what we call the biology of sleep. Now, the biology of sleep affects what we call our central nervous system. We learned that in school, our central nervous system is divided into your brain and your spinal cord. Actually, it's divided into three: your brain, your spinal cord, and your retainer. Now, your retainer is this, your eye. Now, in sleep, what happened, we have a natural clock, a Rolex, a manufactured, godly manufactured clock in our body that is responding to light system, that is telling us, that creates certain chemicals in the body to tell us it's time for you to sleep, it's time for you to wake up. So that is a natural phenomenon in our body. Now, this is what happened. I'm going to go a little bit into biology. When, for example, we approach 5:30 in the morning, whether you are blind or you are asleep, your eyes are closed, it doesn't matter, because what happened, your natural clock is responding to light. The sun starts coming up. What happened behind your eyes, there are what we call retainer ganglia. These are neuron sockets. These are socket of neurons, socket of neurochemical neurons that communicate. They get this light message and it's sent to this retainer ganglia. And this retainer ganglia will send messages to a part of the brain just behind the retainer ganglia called supraschematic nucleus. Now, to make that word very simple, people call it the circadian clock. Now, the circadian clock is our natural Rolex, is our natural clock in the body. That God put it that there so we can wake up and we can sleep. So I will tell you what makes us sleep. What makes us sleep is this. Let's start with what makes us wake up, because I just started that process. When light comes into your eyes, it passes through this retainer ganglia that pass that message to your circadian clock. What your circadian clock do, it sends messages, it activates two things. There are chemicals in the body called inhibitors, neurochemicals called inhibitors, or the other one called excitatory neurotransmitters. Now, the inhibitory neurotransmitters, for example, GABA neurotransmitter, what it does when you have this retainer getting this light, is send it to part of the brain called the circadian clock, the zygomatic nucleus, which is our circadian clock. This particular circadian clock, I'm going to go a little bit into our my paperwork, just to get some of these ideas across properly. So this suprachiasmatic nucleus, we call it the circadian clock, send these messages to our hypothalamus. Now, the hypothalamus is such an important part of the brain. And in there, in the hypothalamus, there is a little tiny part of the hypothalamus called the PVC, paraventricular nucleus. Now, this paraventricular nucleus, if you want to simplify it to somebody who have not much knowledge about biology, you would think that that particular part of the nucleus is like you employ a secretary. A secretary who sits down in the office is giving information, is receiving messages to tell, and then he tell you what to do. This PVC, what it does, after you receive these messages, after these messages come to your hypothalamus, this PVC will get these messages. Now, the PVC will weigh out the sensitivity of the light. If the light intensity is positive, what the PVC does, it allows the body to activate what is called the inhibitory neurotransmitter, so GABA neurotransmitter. As a result of that, it is telling your hypothalamus not to send the messages to your pituitary gland, your pineal gland, but to your pituitary gland. Now, there's two glands that are responsible in terms of when it comes to sleep and wakefulness. Now, your pituitary gland is a gland that is responsible to send messages to your adrenal gland. Your adrenal gland will then produce a particular chemical or a hormone called cortisol. Now, your cortisol can be modulated, can be changed into certain chemicals, two chemicals. One is called norepinephrine, the other one is called epinephrine. Now, epinephrine is a hormone. What epinephrine does, it makes your heart to start beat. It changes together with norepinephrine. It sends messages to your brain to make your heart to beat faster. It makes the body temperature grow. It make you breathe faster. It make you start having heat up. As a result, when you're at sleep, you have to wake up, you start toning, and your eyes just literally has to open because life has to start. Your body has to start generating heat and start producing for you to start being alert. So, in the wakeful state, I'm going to summarize that. What happened, light penetrate, light sensitivity of light is received from your retinar ganglia, which send messages to your suprachiasmatic nucleus, which we call the circadian clock. This circadian clock in there will send these messages to your hypothalamus. In the hypothalamus, inside it, there's a tiny little nucleus called PVC, paraventricular nucleus, which will sit down and literally dictate what your hypothalamus have to do. Don't forget, our hypothalamus is responsible with the glands. Any gland that produce anything, hormones, whatever it produces, hypothalamus tend to be responsible for that in the body. So one of the glands that produce what is called cortisol, that make us awake, that have to make us to just, your eyes has to open, you have to start to be alive, is called cortisol. Now, cortisol as a hormone, some people think it's called stress hormone. But we're not going to talk about stress because I discussed that in the past. But cortisol is God's make chemical in us so that we can wake up from sleep, so that we can start, our body can start working, our heart can start beating properly, our body temperature increases, heart rate increases, our stomach digestion increases, we start getting hyperactive, hyperventilated, anything that makes you to move. So you start having that energy to start leaving the bed, have a shower, brush your teeth, have breakfast, go to work. That is your cortisol. So cortisol is not always bad. It is a stress hormone. High level of cortisol will cause problems. But we're not talking about that. We're talking about the sleep pattern. So cortisol makes you awake. Now, the opposite is this. When that happens, say, for example, 5:30 towards 6 o'clock in the morning, when you have this light into your eyes, into your brain, then into your cortisol, into your adrenal gland, produces cortisol, make you awake, then you start getting up and you start eating, drinking, washing, shower, everything, go to work, come back. By the time 6 o'clock approach in the evening, the sun go down, darkness happens. The same process happens because when darkness come in your eyes, this retinar ganglia sense this natural phenomenon happening in the environment, stating that it's getting dark. And what happens is that retinar ganglia will send the messages to this suprachiasmatic nucleus, this circadian clock in our body, this natural Rolex, which never go wrong in our body unless you make it wrong. If you make it wrong, then you will know why you should not make it wrong. But so it will send a message to that. So what happened in this, that messages will go into hypothalamus, which this PVC, paraventricular nucleus, will now sit down to tell the hypothalamus, you know what? The light message I'm receiving is negative. Therefore, don't send messages to your pituitary gland because it's time for this person to sleep. Sending messages to your pineal gland. Now, the pineal gland sat in the middle, in somewhere in between your middle brains, and it's a very tiny little gland. People call it the soul of the soul of the body. It's the only gland that produces a chemical called melatonin. Now, melatonin is your sleep chemical. You only get melatonin in the body if your hypothalamus send messages to your pituitary gland, to your pineal gland, for your pineal gland to produce melatonin. And that happened through the activation of this excitatory neurotransmitter, because what that does, it excited the hypothalamus in such a nature that the hypothalamus, the process over there, I don't want to go deeper into that, but there are other molecules involved. So they will prevent the hypothalamus sending messages to your pituitary gland, but rather sending messages to your pineal gland. Now, your pineal gland produces what is called melatonin. Now, melatonin will make you feel sleepy. It makes you sleep. So this is what is called photohormone phenomenon. If you look at the neurobiology, the process is called photolight hormone. It involves hormones phenomenon, but melatonin, cortisols are all hormones. So it's called photohormone phenomenon. So that's one part of it. But another part of it is called neurochemical phenomenon. Now, neurochemical phenomenon is important to know because this is what happened to people. People's body will produce melatonin. You will feel sleepy. You will go to bed to sleep, but you cannot sleep. How many people have experienced that? You feel sleepy. Oh, I want to sleep. I want to sleep. You go to bed, you lie down toning from 8 in the evening up to 7 o'clock in the morning, or maybe 3 o'clock in the morning. You cannot sleep because there are this particular chemical called neurochemical that needed that process to happen. And if you don't have the balance of those neurochemicals in your body, you will tire to go to sleep, but you cannot sleep. Or if you sleep, you'll have a breaking sleep. You sleep 30 minutes, you wake up, you sleep, so you don't feel you sleep. It's a natural sleep, it's a natural process. It means to rebuild certain things in the body. If you don't have quality sleep, at least 8 hours window, you will not have that natural process happening regular basis, and therefore there will be a problem. But we'll come to that. But this is the process. Now, the neurochemical process involves 3 particular neurons, neurochemicals, and we probably have to mention that serotonin, everybody heard about serotonin, is one of those chemicals responsible for your mood, your happiness. You see that when people are depressed or have anxiety, you give them medication that help them to increase the level of their serotonin. Now, don't forget, serotonin is responsible. Serotonin is made from the food we eat. The food you eat is processed in such a way. Serotonin, dopamine. Remember we talked about dopamine before? So serotonin is a chemical that our body needs for us to feel motivated, happy, content, cool. That's serotonin. Now, it's a natural chemical that our body produces. So important that when your brain produces it, your brain don't want to discard it. What your brain does is to take it back and store it. So people who have anxiety and depression, the medication they give it to you, they block that withdrawal back process. So you still have some left in your brain. That's why people whose brain are not functioning properly in time of depression and anxiety, when they have that anxiety episode, it looks like the brain naturally is withdrawing that serotonin in the brain areas. As a result of that, your mood just go woof. You get anxious, you get depressed and all that. So the antidepressant you're taking, for example, serotonin, fluoxetine, all that antidepressant medication, what they do, they call SSRI, selective serotonin rehabilitative index. So what they do, they block that process so you have more of this sort of. But that is another thing we have to talk about. In this sleep process, serotonin is responsible to change itself to melatonin. Remember, we talk about neuromodulators. Neuromodulators can be neurotransmitters and they can be neuromodulators, and they can transform themselves from being a neurochemical to a hormone. Now, a hormone and neurochemical are different. I have to say this because the idea is to give people some idea of these basic scientific ideas. So a hormone is a chemical that is produced in one part of the brain and has its effect in the other part of the brain. And it's only produced in the body. Let's understand that bit. Whereas human beings and animals, some animals and plants have hormones. But neurochemicals are only produced in your brain, and only anytime they change to come into the body, they change their form to other type of chemicals called hormones, right? You can have a particular hormone that can be converted to neurochemical. For example, you have adrenaline. Adrenaline, when it's released and you want to do certain things in certain part of the body, it can change itself to what we call norepinephrine. Norepinephrine. Norepinephrine now became a neurochemical, while epinephrine is another hormone, but it's more little bit body friendly than adrenaline in terms of where it works in different part of the body. I'm not going to go too much into that science, but the idea is for you to know melatonin is our sleeper chemical. So this melatonin is manufactured from serotonin. Serotonin is manufactured from food. So don't forget your diet. If you want to have a better sleep, have a quality diet. Your diet has more important things to do with your sleep, because if you don't have serotonin, you get anxious and depressed. Not only that, your level of melatonin will not be great, because serotonin will not be converted to melatonin because your body needs more serotonin. As a result of that, your pineal gland, it doesn't actually manufacture melatonin, it stores it and release it so you can sleep. So you cannot store enough of it. As a result of that, it cannot release enough of it for you to sleep. But that is when people have sleep disorders. We'll talk about that. But so to put you to sleep, your pineal gland will release this melatonin into the body as a hormone. Melatonin will make you feel sleepy. Now, this neurochemical I talk about, serotonin is part of it. So your body needs serotonin in able to make melatonin. Your body also needs what is called norepinephrine. I talk about norepinephrine because norepinephrine make the activities of other hormones to do their work appropriately and properly, and it is very perfectly made in that way. Another chemical that we need to talk about, which is so essential, so important to the public to know, is a chemical called adenosine. Now, adenosine is a natural body chemical that the moment we break into day, the body starts producing adenosine. Adenosine is a drowsy body chemical. It makes you drowsy. So when it's time to sleep, you actually sleep perfectly well. So you have melatonin produced to make you go to sleep, but adenosine make you sleepy. So adenosine actually is the chemical that make you to go and sleep perfectly with a good window of time. Remember, melatonin is a silly chemical. Without melatonin, your body will not recognize to go to bed. So melatonin, you need that for your body to recognize to go to bed so you can sleep. If you have low level of adenosine, what happens? You go to bed, but you have break sleep. You cannot sleep properly. With adenosine level gradually developing to higher level, to threshold level, your body, and with that and melatonin, you sleep. Wow, you sleep heaven. Now, this is the problem. Those of us who drink coffee, who drink tea, attire, whatever drink you call it, it affects adenosine level. Tea, coffee, attire, whatever, these herbal medications you take, people are taking everywhere without actually getting consent from professionals who know about these herbal medications. They have impact on your body. One of the impact they have is they act as an antagonist to this adenosine receptor. Now, if you drink coffee, what coffee does, when you talk about an antagonist, it's like a key and a lock system. I'll show you this because it's important to talk about agonist and antagonist. Now, an agonist is a chemical, natural chemical that we make. For example, certain medication we take can act as an antagonist, which means they can mimic the action of natural body chemicals. So what happens is, like, say, for example, if you take an agonist, for example, let's say morphine, people who have pain problem, for example, if you take morphine, your body produces certain natural chemical that should control pain. But if your pain level go to a level where your body natural chemical cannot control it, we give you morphine. So morphine mimic that body natural chemical. Morphine acts like that body natural chemical because morphine is an agonist. What that means, morphine will come into a locker, a door, and open it. So it open it and the door open. So when the door open, you see your cells start functioning. It stop the pain process. Okay, that's what's called agony. Agonists get into the locker and they can open the door and they can make the cell do work. That's called agonist. Now antagonist is this. Antagonists will come into a locker, lock it, but they cannot open the door and they cannot leave the hole. So as a result of that, the chemical that should come inside this keyhole, open the door and go inside so the cell can do the work, will not go because this key is there. So as a result, an antagonist block that receptor. So if you drink tea or coffee, what coffee does, it block the hole, it block the receptor of adenosine. So it's not allowing adenosine to go in there to make you sleepy. At the same time, the coffee is sitting there, it's not doing anything. It's preventing things to happen, and it's not doing anything for you. So the coffee literally is preventing you to sleep. No wonder why when you drink coffee at late night, you go to bed, you turn upside down, you can float around your head, and you still don't sleep because your adenosine level will go there. Whereas in natural process, when there is no coffee, no tea, what happens is daybreak, all this natural process happen. By 6 o'clock in the evening, your melatonin level increases. You tell your body, go to sleep. By 8 o'clock, your adenosine level goes up. You go to sleep. You have 8 hours sleep. By 5:30 in the morning, this process start again. You got your cortisol coming up, wake you up. Your epinephrine heat up. Your body start functioning. Your heart beat properly. Your stomach start digesting. Everything start working. You get up, brush your teeth, shower, go to work, find food, whatever you need to do to survive. You do that. And that is the process of sleep. Now, the next thing we're going to look about, I don't want to go through this presentation because I did this in the university just a couple of days ago. I just want to summarize the thing. We're going to look into phases or stages of sleep. Now, it's exciting to talk about phases of sleep or stages of sleep because the phases of sleep and stages of sleep are different. We've got 2 phases of sleep. And you've got 4 stages of sleep. Now, phases is moving from one phenomenon, one process, to the other process. While stages is like you are doing something, but you have to take one stage. Let's put it in a simpler way. If I'm making a car, for example, I have to take from one stage to other stage before I can finish the car. So that's stages. Now, phases is different. Phases is like if I'm ordering something, they have to ask me to put my credit card information in. I have to put some of my details in. So that's phases. It's English language. I'm not British, I'm not English, but I think you understand what I'm talking about. So that is the difference between a phase and a stage. Now, when you talk about sleep, we're talking about 2 phases. And when you're talking about stages, we're talking about 4 stages of sleep. Now, the 2 phases of sleep one is called what is called rapid eye movement. In the rapid eye movement is very simple. It's a light sleep, and it's like a very sort of a very, very light sleep. You know, in my language, in whoever can speak Gambian Mandinka language, Jahanka language, we call it jingo. You know, a jingotale. So you literally close your eyes. And you know, you're aware of what's happening, but there are certain things you're not aware of. You're not seeing things, but you can hear things. Sometimes you can feel things. Sometimes you think you can hear people talking, and then you pretend that you can hear, but obviously you don't. And you just literally, you know, in that state. But when something happens, you can be in that moment. It doesn't mean you are off completely. That is rapid eye movement stages, phases of sleep. So it's a point where people get what is called you breathe quickly and shallow breathing. It's consolidation of memory. You know, it's a relaxed sort of process. It's good because most people tell you when you're at work, you take time, 10 minutes, 5 minutes, snap. Some people call snaps. just chill out. It's like that. It releases stress. It's a process to learn. If you're actually struggling to capture idea, philosophy, phenomenon, have this rapid eye movement moment where you just sit down and just literally relax, put your mind on this particular process. And before you know, this thing is just sort of naturally deal with in your head. And you start actually analyzing beyond how you see it. You start seeing different pictures of what that problem looks like and how you're going to handle it. So some people call it synapses. So, so it's a relief stresses, it makes your muscles, it's a time when you get to relax, So the other phase is called non-rapid eye movement. And non-rapid eye movement have 4 stages. Stage 1 is your drowsy stage of sleep. When you are going to sleep, you go to bed, you're really going into sleep. Remember, at that stage, when somebody want to wake you up, you actually refuse to wake up. People who start wake you up, you're not sleeping like deep sleep, but people start lapping your get up. No, I don't want to get up. You don't want to get up. You are in a drowsy stage. You just want to sleep at that point. Then stage 2 is actually fairly in a light sleep. Your working stimulus are turning off. You cannot hear what people are discussing when you're in that stage. You don't see things, you don't actually know what's going around. You are literally in a light sleep, going into a stage 3 sleep, which is going into deep sleep. And then, of course, stage 4. Now, stage 4 is a stage where you have your sort of most of these interception take place, where the body repairs damaged cells, the body repairs what is called the cytokines, these chemicals that the body don't need. They're inside the body. If you don't take them, they cause problems. So the muscles absorb some of these, repair, growth happens, people increase their height, their size, whatever. It all happens in stage 4 of your sleep. So don't forget that. Now the question is, how much sleep do we need? Now I'm gonna use this slide because I think it's important, because some people, you can tell them go to sleep, they sleep, 2 hours later they wake up, they say, oh, I got a fantastic sleep. No, you don't. You don't. You need to sleep as an adult minimum or maximum of 7 to 8 hours. You need that if you really, really want to live healthy life or longer life, and you want your body to recover very well. But for babies, we're talking about newly born, we're talking about 18 hours. 1 to 12 months, we're talking about 14 to 18 hours. 1 to 3 years, we're talking about 12 to 15 hours. 3 to 5 years, we're talking about 11 to 13 hours. 5 to 12 years, we're talking about 9 to 11 hours. A young person, we're talking about 9 to 10 hours. An adult, we need 7 to 8 hours. A pregnant woman, you need 8 hours plus sleep. Don't forget, you need your sleep. You do. Now, there are so many factors that affect sleep. And we're going to say this because it's important. Not only are we talking about the biology of sleep, when you're talking about the photohormone phenomena, and we're talking about neurochemical phenomena, there are environmental factors that are also so many factors that can affect you sleeping properly. And one of these is stressful life events. You can imagine when you say, for example, you witness somebody in a car accident, for example. That's a very stressful scenario. And when you go home, your mind is actually you ruminating over that event. Your mind cannot rest, because what that does, that trigger your stress hormone, arousal pathway. We talk about stress, we talk about anxiety, we talk about this RAS, reticular activating system in your brain. All that part of the body called amygdala. Amygdala is such a wonderful brain part of the brain structure. That is it's so nice to know that thing is so good. I'm still learning that thing. But what that thing does, it responds to your stress mechanism. It actually makes you for your fight and flight mechanism to happen, that amygdala part of your brain. But the good part of also is the amygdala sort of connected with the hippocampus. Now we talk about hippocampus when people develop some sadness process. Sadness and stress and anger and all these things we talk about it. But sadness happens when the connection between your amygdala and your hippocampus get affected in a short window. So you get this feeling of depressed. You're just sad because you probably lost something, or probably you want something, you didn't get it. You get disappointment, that sort of thing. But as that developed to a higher level, what your amygdala do, your amygdala start activating your stress pathway, your arousal pathway. We're not going to go into that, but it's just for you to understand. Another thing that can affect sleep is actually your routine bedtime. I mean, come on, guys, go to bed. Decide what time you go to bed. If you're somebody who go to work every day and you start your work at 7 in the morning, please do go to bed about 9, 10 latest. Don't go to bed at 12, don't keep just watching TV until 2 o'clock and you go to bed. You're not going to have enough sleep. And eventually what happens, you are revising this natural clock process. Anything against nature is against yourself. You're causing problem to yourself. Remember, that is the reason why God created that clock system, that Rolex, that never lose time. You can mess around with it, but you are messing around with yourself. So remember, this clock start working from 6:30 in the evening when the sun go down. You see, when you look at our forefathers thinking patterns of doing things, you wonder, how do they know this thing? I remember when I was young, my mom used to tell us by 7 after Fitiro, we call it Fitiro time, at that time they will ask us to go inside. There are some biological connection to these. These things are so biologically and naturally embedded in our body. If you go against it, you have problems. You go to certain villages still now in rural areas, there are elderly people who go to bed roughly latest 8 o'clock. And they wake up roughly 5 in the morning or 4 in the morning. Those people will live up to their 90s or at least 70s. They will not die because they are following natural phenomena. If you follow nature, certainly you will live long unless you die in an accident. But I'm not guaranteeing that. I'm just saying, let's follow nature. That's the word. Yeah, so that bedtime routine is important. If you're struggling with bedtime routine, try a diary. Get a diary, guys. Write it down. Today you go to bed 8 o'clock at night and you sleep these hours. Tomorrow you go to bed 12 o'clock at night. You sleep these hours. Compare how you feel these 2 days. What happens? How do you function mentally, physically? Compare. And get this diary running. By the time you come to 2 months, you know exactly what time is good for you to sleep. What time is not good for you to go to bed. The next thing is environmental factors. Avoid noise. Guys, you go to bed, you have your phone ringing, you have your phone in messages. Turn your phone off. Go to bed. I'm saying this because this affects your natural phenomenon. It affects this biological photo hormone process. It affects your neurochemical process. It affects your digestion, everything. It does affect this interception and extraception natural processes. So please avoid noises. Cool your room down. Remember, the hotter the environment is, the harder is to sleep. The cooler the environment is, the easier it is to sleep. The best is in the middle. Get a place where it's not too hot, it's not too cold, it's cool. Sleep. That's important. Uncomfortable bed. Come on, guys, get a bed that's at least comfortable. Get a bed that is comfortable. When you talk about comfortable, you're not talking about luxury. It's different. We're talking about comfortable. Kamara Kundankor, if you're listening, you see the cameras. You never use a comfortable bed, but please try comfortable beds. They make you sleep better. Another factor is actually our physiological factor. You will never have good sleep when you suffer from significant physical health-related problems, particularly pain. If you are in pain, you don't sleep. If you have certain disorders such as snoring, you will sleep, but it does affect your sleep because what snoring does is it affects your breathing processes. And in the breathing processes, we have your adrenaline working. Your adrenaline is actually work into, there's 2 types of sub-receptors in the adrenaline. We call adrenoreceptors, alpha adrenoreceptors, beta adrenoreceptors, and then one work in the heart, the other ones in the lungs, the other ones in the muscles, the other one in the blood vessels. So these receptors are very good when they responded very good to the amount of oxygen we have, because that affects our blood pressure, it affects our heart rate, it affects our functionality, it affects our intelligence, it affects so many things. So guys, don't forget, if you gotta go so snow too much, what you need to do is actually take that person to a professional. There are people who can train you how you can come out of this snoring behavior. It's very easy somebody to fall into that just because the way they lie down. There are certain way you lie down, it make you snore for the rest because you're blocking your airways. So you need to lie down in such a way your airways are open and you can breathe properly and the snoring process can die. But if you don't do that, you don't sleep well, the next person to you don't sleep well. No wonder why those husbands who snore, their wives struggle at work, they cannot sleep properly. Please do seek help. Another thing is an unhealthy lifestyle. Now, if you use stimulants, those of you who take stimulants such as amphetamine, cannabis, name it, coffee is a stimulant. What that does, it increases this particular chemical in the body called dopamine. Now, dopamine, as we have spoke about, has this tonic level and phasic level. And if your dopamine go to that phasic level, guys, it messes you up. So please do not use stimulant. If you want to go with my advice, don't take stimulants. Cannabis, excessive amount of coffee or tea, amphetamines, cocaine, name it. They're all stimulants. Don't take it. Okay? Sometimes lack of exercise can cause you not to have good sleep. What lack of exercise does, it builds a perception of your brain where your body sort of functionality get affected. So when we talk about exercise, we don't talk about going to the gym. We're not talking about gym. We're not talking about taking 20, 50 press-ups. We're just talking about getting up, do your household things, go to work, walk about, make your drink for yourself. But you wake up, the next minute you sit down in the chair, the whole 24 hours you're watching TV, sitting, somebody's feeding you with coffee, tea, whatever it is, they just give it to you. You only go to get up when you have to go to toilet. What are you doing? You're affecting your body functionality. There are certain mechanisms that have to happen in the body. It only happens when you are in motion. It makes your muscles to absorb certain things. That absorption produce certain chemicals, certain hormones, certain molecules, certain proteins. The body need those proteins. They're like engine stuff. They make you do things, but they also get rid of certain things. They make your kidney work properly. They make your liver to metabolize properly. If you don't do, you're causing more problem because in the liver, we're gonna go a little bit into that biology. The liver has certain things. We call it cytochrome P450. This family of enzymes are particularly very important in terms of your functionality. So guys, do that. Do some exercise. Light is also important. Be aware, the darker your room is, the more you go to sleep quickly. If you keep your light up in your bedroom, the chances is you will not have proper sleep. Another thing that will affect your sleep is your mental health problems. If you have sleep disorder affects people, and sleep disorder can happen in different ways. We'll come to that. I think I've got a slide to talk about sleep disorder. There are other things that make you have problem with sleep. Shift patterns, the way you do your work shift. If your night and your day are just messing about at your workplace, your sleep clock will get messed up, and then you get messed up. Menopause. For those of you who experience menopause, it does affect your sleep. If you are in doubt, you need to speak to a professional to help you how that affects your sleep and how you need help, what sort of help you need to understand, to get insight so you can have better sleep. And those are important for you to be aware of. However, the benefit of sleep is that it is a biological function. When you have proper sleep, what happens? Your body produces what is called growth hormones. Your body builds certain things in your body, so you get bigger, healthier, taller. Those of you who are young are growing up. So you get your growth hormones doing their job. It's a period where you have restoration. You have recovery of things. Things that are damaged in the body are restored. These chemicals that your body don't need are absorbed into the body or are getting rid of. It's important. It provides, it's a safe way of experiencing your emotion. When you are sleeping, it's a very safety emotional state of being. whoever had good sleep, you know what I'm talking about. So it regulates your emotion, it improves your physical health, it improves your social life, it improves your interpersonal skills. Now, if you have sleep problems, if you don't sleep properly, this is what happened to you. You will have significant amount of problems. You will be irritable. Your cognitive function will be impacted. Your decision making, your planning process, your intelligence will be affected. Your memory will be affected. You have severe problem of yawning. Every 5 and 10 minutes, people are talking to. It's crazy. You need to avoid it. It's a disorder. It's an impairment. You need to be sorted. You will develop ADHD. That's not doubt that you will have hyperactive disorder. You will be hyper in many ways because what's happening, you are going against natural phenomena. So when you have lack of sleep, so many things goes wrong in the system. As a result, you don't stay in one place. You become really very hyperactive. And your concentration became poor, your focus became poor, your attention became poor, your interaction with other people became poor, you get more angry, became more impulsive, you start harming yourself, you start harming other people, it start being really very difficult. Be aware of that. It does affect your immune system, there is no doubt. Your lymphatic system gets affected. The good thing is, so there is thing here called the thymus gland. It's one of those beauty of nature. As we grow older, it disappears. It just absorbs into the body, the thymus gland. It's one of our body defense mechanisms. We're born in this. When we are born as little, it's bigger. As we grow older and older, by the time you are on my age, it just absorbs, it just disappears. Now, there's so many scientific philosophy or theory behind that. I'm not going to go into that. But those of you who don't know, we have a gland here called the thymus. Whoever ever had a chicken, if you kill a chicken and you take that spiral, you will see a little thing there. It looks like a lung. It's not a lung. It's called the thymus. It's a gland. It's one of those we are born with, and we born it bigger, and it help us protect our body. But as we grow older and older, by the time you hit your 30 plus, it just disappears. It is never there. There are theory that says that before it disappears, it teaches the body how to protect the body. How the body protect itself, then it disappears. It's like a father. You marry, you get children, by the time you're 60, you don't, family don't need you. Your children took over, you're gone. So that's what the theory about the thymus is. It actually teaches the body how to protect itself. As a result, when you grow older, we don't need it. So when we are younger, our immune system is not matured. So therefore, we need the thymus to help the immune system to grow. And the thymus will teach the immune system about different ways to defend itself. Once they all get matured, the thymus will disappear. How wonderful nature is. I mean, it's our theory, but God knows exactly why. When you are little, when you are born with thymus, it's bigger. And when you grow older, it disappears. Wonderful, isn't it? This is the beauty of science. This is when you know nothing. I mean, I feel like when I look into these things, I feel thankful to God for giving me the opportunity to have this curiosity. But you just don't know anything. You know nothing. But enough of that. Lack of sleep will cause you to have problem with your heart. It will cause you trauma, achy, a lot of problems. So please do have good sleep. Type 2 diabetes. Lack of sleep will give you that. So there are different types of sleep problems. Now, if you have problem with having sleep, don't think that you're just making it up because you cannot sleep or you're drinking a lot of coffee or because of your shift pattern. It actually might be a physiological problem. That is what is called insomnia. It's actually a difficulty to get sleep. If you do have that, you have problem waking up. You have difficulty actually settling down to sleep. There's something called hypersomnia. This is sleeping too much. A process where somebody 5 and 10 minutes is gone. I had a friend, and when I'm teaching this stuff, his name always comes to my head. This guy is just sitting with you. He's speaking 2 words. The next minute is gone. I don't know what's wrong with him, but I thought he has that. I never tell him that anyway. But if you have people like that, they need to see a clinician so they can have help, because there are treatment for these problems. You don't treat it, but you manage it. That's a word. There's a difference between treatment and management, and cure. We're not going to go into that. So there is cure, there is treatment, there is management. There are things you can treat and cure. There are things you can treat and manage, but you cannot cure. So, but that's not the topic of today. We'll talk about that. So, with sleep disorder, some people have what is called sleep-related breathing disorder. We talk about snoring. We talk about sleep apnea. Sleep apnea affects massive amount of population. So don't forget that if you have sleep apnea, seek medical help. All right, enough of all the problems. What we want you to do, what I want you to pay attention to is actually how do you get help to solve your sleep problems. Okay, the rule of the thumb, diary. Have a sleep diary. Monitor it for 30 days. Then you know where you fall. Then you find a pattern. Then use that pattern. Second term, rule of thumb, sleep hygiene. Now, sleep hygiene is massive. It's a thing that most clinicians will teach their patients before they give you sleep medication. Now, sleep hygiene is about environmental factors. If you have physical related problems, it's about looking into that, have insight what problem is, treatment pathway. It's literally giving you some more knowledge about what's going on with your environment, with yourself, with your diet, with everything. And then work that together to be able to get a good sleep. There is another thing called get a regular exercise. There's another thing called be smart with your sleep patterns. There's another thing called help with your stress. If you are stressed, you will not sleep. Postpone your worrying. People are worrying too much. There's so many people who have this problem called warriors. And when I say warriors, I don't mean people who fight. Warriors are people who just cannot stop worrying about things. They cannot stop just worrying. They worry about everything. Even if I take a tissue and it drop on the floor, they worry about it. Come on, guys, chill out. Life is life, man. There's not much you can check certain things. If you worry too much, you die early. Don't worry about everything. We worry about everything. Our finance, our children, our this. You're not in control. You can try as much as possible, but what your child will be. You can try as much as possible. What your future lies will lie there. I have this fundamental sort of belief system. It's not a belief system. I think it's an ideology system. It's not a belief system. It's an ideology system. But it has been faded by so many professionals, and the idea has been accepted by so many professionals. What will happen will happen. Don't think your child, you can manage everything. Your support, your help is needed, your direction needed, yes, your effort needed, yes. I'm not saying don't do anything. What I'm saying, don't be a warrior. Every little thing you worry. They don't pay you yesterday because you meant to be paid yesterday and you didn't get your pay yesterday. You just literally cannot sleep for the whole night. Come on, calm down. Just call somebody who needs to sort that out and sort it. Okay? Or something happens. There are things that I'm going to give you a tip about this. When I have clinic, there are things that I tell people, particularly people who are warriors, people who worry too much. There are few things you can do in life. That's a factor that you control. As a factor you cannot control. Now, if you worry about factors that you cannot control, you will die early because there's nothing you can do about it. If you worry about a factor that you can control, you are an idiot because you don't plan yourself. So what you have to do, factors that you can control, when that circumstances changes, when something happens, it's a thing that you can control. You need to analyze, you need to find out the solution to that problem and work it out and get a solution and solve the problem. Stop worrying. Solve the problem. Things that you cannot control. Say, for example, I'm here in the UK. I get a phone call in Gambia. I'm from Gambia, by the way. In the village, they told me your brother or somebody beat your brother. And I'm here. And I start worrying about all that. What am I going to do about that? And all I have to do is just call my brother. How are you? Are you all right? Or are you in hospital? Is everything all right? Can you guys just sort this out? I mean, am I going to take a flight and go there? But if you're a warrior, you start bloody phoning everybody from yourself in England to your families in America, in Dubai, in everywhere, and make everybody worry about something that is just Nothing to worry about. This guy just involved in a fight, they beat him and it's done. It's done. Let him solve his problem. Warriors don't think that way. Warriors think a little problem as massive as this, and they cannot stop worrying about it. And they cannot do anything about it anyway. Don't be a warrior, please, because it will cause you problem. And enough of that. I'm not a preacher. I'm just giving you some clue about your health-related issue, particularly mental health. Now, there's a thing called what we call CBT, cognitive behavioral therapy. Now, CBT is a well-known evidence-based therapy that we give it to people. It's about somebody who has a problem with sleep. There must be a link why he has that problem. You think about that thought process, and then you try to change that thought process to a healthy thinking process, and then work out the solution to the problem, and then hopefully sleep improve. So CBT has a lot of way to deal with sleep problem. We also have behavioral intervention. So as I say, we have sleep hygiene, routine issues, relaxation techniques, mindfulness, etc., etc. And to be honest with you, that comes to the conclusion of our sleep. The idea is not to cover everything, but you can realize that there is a very little knowledge about sleep. If you mean talking about all these phenomena, all these processes, all these things, I have no idea why God prescribed sleep for us in terms of this phenomenon of circadian clock. Why do we have those natural clocks? I know why we have those natural clocks now by looking at this phenomenon, but then that natural phenomenon, why is it that it's not being absorbed into our healthcare system, such as the way we look at food? If somebody refuses to eat food for 72 hours, we do everything possible. If somebody's not drinking, we do everything possible. If somebody's bowel is not open, we do everything possible. If somebody is not passing urine, we do everything possible. Now, if somebody's not sleeping, we don't do everything possible. And this is what we have to change, that attitude, that behavior, that philosophy, that thinking pathway to make sleep as important as the food you shopping. Anytime you start shopping, think about your sleep. And that has not to deal only with you, it has to deal with your family. If you're sitting down with children and you're feeding everybody with chocolate, what happens? You're affecting them, because chocolate works the same way coffee works. So chocolate and coffee will have impact on child's sleep. So remember that. If you're drinking coffee, your child is eating, filling their tummy with chocolate, you are causing more problem to the child. So it's about having this insight of these phenomenons, having some, some thinking. Hopefully that will help. And if you want to do more research on that, these are the websites you can actually go into. They will give you massive knowledge about sleep. Massive knowledge about sleep, how to help yourself with sleep, and how important is sleep, and how you can also help somebody with sleep. So if you are listening, thank you very much. I appreciate your time. Thank you.